Okay, go ahead.
Later this summer, we will be transitioning our enteral supplies to ENFit. So ENFit is the special connector that you see on this tube and also on this syringe. This is a reverse lure technology that only allows enteral syringes to be connected to enteral tubes. So this will reduce the risk of misconnection from things like oral syringes to IV lines and vice versa. The difference between an ENFit connection and what you're used to seeing on what we call legacy tubes is this moat that surrounds the central lumen, which we will talk about cleaning for that later. One of the perks of our ENFit transition is that with our hazardous drugs workflow, when we crush meds in these little bags, we will no longer need adapters to make that connection. It slides right on.
Okay, so we have a variety of sizes for our ENFit syringes. You'll see on the larger ones, they just have the large bore for drawing up medications. When you get down to the 6 ml size, you'll notice what we call the low dose tip. So you'll see the middle portion where the medication will be pushed through, and then there's the space around it, which we call the moat. That'll be on the 6 ml, 3 ml, and 1 ml syringes. When drawing up medications for these low dose tips, you're gonna want to include the medication straw. It's a simple attachment, just like all of ENFit connections, and you'll want to put it into your solution and draw up so that you get the accurate dose. The risk with not using the medication straw is that if you stick the syringe directly into the medication, you fill that moat with medication and have risk for medication error.
If you have a patient come in from an outside hospital, or if there's an inpatient that already has a legacy tube placed, we can still access this using ENFit equipment. It would require an ENFit syringe or possibly ENFit compatible tubing sets, and you would add the transition piece to the tip of whichever device you're using and use that to access the tube.